Welcome everybody. Hello everyone and welcome to today's launch of the Embracing Equality Pledge. We're so pleased you could join us for this very special day and very special event. My name is Deb Sabaris and I'm the CEO of the Centre for Excellence in Child and Family Welfare, the peak body in Victoria for children, young people and their families. Before we begin, I would like to acknowledge that I'm hosting this session from the lands of the Wurundjeri people of the Kulin Nation and pay my respects to elders past and present. I acknowledge that sovereignty was never ceded and this is and will always be Aboriginal land. And I'd particularly like to give a shout out to my Aboriginal colleagues here on this meeting today, and particularly Raylene Harradine, who I can see in the box up here to the left. Welcome. A quick note on housekeeping. Today's session is a Zoom webinar. I know you could hear us all chatting before, so we ask that you please use the chat function for any questions or comments. I'm sure there'll be lots of lovely things that you want to say on this very special day. We're also recording this session so that we can distribute this afterwards to those who weren't able to be here. As I said, today is International Day Against Homophobia, Biphobia, Intersexism and Transphobia, or IDAHOBIT Day. It's the opportunity to celebrate LGBTIQ plus people globally and raise awareness of the work still needed to combat discrimination and inequality. We've specially chosen today for the launch of our Embracing Equality Pledge, as it recognises that we have come far and we're heading in the right direction. But we still have a long way to go and we want you all to be part of that positive change with us. As Australian firsts, the Embracing Equality Charter and the pledge have been developed by our group of leading peak body organisations representing Aboriginal controlled organisations, health, mental health, alcohol and other drugs, unions, homelessness, social and child and family services sectors who are pledging allyship with LGBTIQ plus Victorians. These organisations, there's a vast number of them. I'll give you the list because I don't want to leave anybody out, and if I do, I'm sure I'm going to get into trouble. The Victorian Aboriginal Children's and Young People's Alliance, the Youth Affairs Council of Victoria, Council to Homeless Persons, Victorian Healthcare Association, the Victorian Alcohol and Drug Association, Mental Health Victoria, Victorian Trades Hall Council, Victorian Aboriginal Controlled Health Organisation, the Victorian Aboriginal Child Care Agency or VACA, the Early Learning Association of Australia, the Centre for Multicultural Youth, Foster Care Association of Victoria, No to Violence, Kinship Carers Victoria, Grandparents Care Victoria, Victorian Council of Social Services, the Community Housing Industry Association and Domestic Violence Victoria and DVIRC. And as of today, those logos are still coming in to sign on to the Charter. We all come together as allies because we recognise that while LGBTIQ plus communities are resilient across almost every measure of health and wellbeing, LGBTIQ plus people fare significantly worse than non-LGBTIQ plus people. And we'll have Adam Bourne speaking about this today. In developing the Charter, we peaks have committed to uphold the human rights of the LGBTIQ plus peoples, ensure LGBTI inclusive services and education, and build a sustainable LGBTIQ plus community controlled sector. But today is about the launch of the Embracing Equality Pledge, which sets out specific commitments for service providers that relate to better understanding of intersectionality, building relationships with LGBTIQ plus communities, and ensuring safe and culturally appropriate services. This group will also be working on a pledge for unions and other groups so that more people can join the campaign to end the inequalities and discrimination experienced by the rainbow family. But today we'll be also asking Victorian-based service providers to sign on to the pledge via the Embracing Equality website and pledge to embrace equality with all of us. And there'll be a demonstration at the end of this event to show you just how to do that. And I probably will need that demo as well. But without further ado, I now want to introduce the Honourable Martin Foley MP. It is my honour to introduce the Minister for Equality, the Honourable Martin Foley MP. Martin has been an outstanding advocate for equality and ally to the community. He's been part of sweeping changes, such as passing of the Conversion Practices Bill, the announcement of Victoria's first whole-of-government LGBTIQ strategy, and providing vital funding and supports for the LGBTIQ+ sector in COVID recovery. I'd like to also acknowledge the attendance of Ro Allen, the Commissioner, for LGBTIQ plus communities in our audience today, as well as the Honourable Harriet Shing MP, Parliamentary Secretary for Equality. I'm very excited about having the Minister here today. He said I need to get a life, but nonetheless, I'm really proud to be working with you, Minister Foley, and I'm going to hand over to you on this very special day, your birthday, I understand, being with us today. So happy birthday from us all, and thank you for being here.
You're very kind, Deb. I didn't say don't get a laugh. I said you've got a low threshold of excitement if it's exciting talking to me. There's an important difference. So can I thank the organisers of the meeting for the opportunity just to say a few brief words. And like you, Deb, I'd join in acknowledging that we all variously meet on the lands of the First Peoples of this country, and I pay my respects where I am, like you, to the people of the Kulin Nation and the people of the Wurundjeri and their close cousins, the Boonwurrung. So can I thank the organisers of the Embracing Equality Charter for the outstanding efforts that they've done in putting into practice a lot of the positions that we all talk about and all seek to live through our various work. And to do so today on IDAHOBIT Day is a very significant move by the organisers of the Embracing Equality Charter, or pledge. I've got to get my language right. And it points to very much the, I think, shared values and the growing levels of the intersectionality opportunities for how genuine change and community-driven and community-owned, LGBTIQ plus community-driven and community-owned reform is going to take place. Yes, it needs to be led by and from and resourced through self-determination principles of the LGBTIQ plus community and all of its various intersectionality points across the rainbow. And I think there's been important work done there. But what this pledge and charter shows is that sustained, enduring reform comes through the multiplicity of support in all of the different intersection groups that the Charter has identified. And Deb's gone through them all, but as Deb indicated, today is a day to reflect on the continuing inequality, the continuing poor measures of any number of outcomes that the different groups here all organise and campaign around and deliver services around in our community. But through just about every one of them, I dare say, members of the LGBTIQ plus community are on the roughest edge of all of those measures. And it's the cumulative effect of all of those negative measures that drive so much of the reform passion and reform effort that we see reflected in this pledge. And the fact that government needs to resource, support, facilitate, legislate and campaign in this space in partnership from those same shared values is critical to improving the outcomes of LGBTIQ plus Victorians, and I'd like to think might well be able to set a pattern for other jurisdictions around the Commonwealth. That's why efforts such as the various groups that government has set up and programs across different spectrums of the public policy and government activities across the state are so important, be they in health, be they in justice, be they in education, and then trying to bring all of those together for the whole of government approach so as to embed those changes deeply into the practice of government's activities, but in so doing, make sure that we change for the better those government activities, and in so doing, empower the community-led responses that the Charter so eloquently sets out. And on IDAHOBIT Day, it is given that it's variously the days in which, whether it be the World Health Organization or different governments around the world, have reflected on what their role is in this space. I can happily announce that in the budget on Thursday, subject to all the normal telling a recorded Zoom meeting, probably not that much keeping it off the front pages, but nonetheless to be announced this Thursday in the state budget, a range of measures that rack up to $45.4 million to celebrate, and I'd like to think start to operate some of the goals, aspirations and values reflected in the Charter. And they go to measures such as a $6.4 million funding for our friends at Switchboard for the Rainbow Door program, a $2.4 million program to expand the Healthy Equal Youth project, which has been so important in empowering and supporting diverse groups right across our state. A range of leadership and other measures, support for the 40th anniversary Melbourne Pride event, but at its heart is a $21 million package to bring together across how government works, community works, clinical services works, peer groups work in the trans and gender diverse communities. We've seen since 2015 a 400% increase in the service demand on the Royal Children's Hospital and the Monash Gender Clinic in their important services. But we know if it's just going to be a clinical service, we're not going to deal with the whole aspects of that community's increasing levels of demand. So what we'll be announcing in the budget is a program that both expands those clinical services, both at the RCH and Monash, but also brings together Transgender Victoria, Transcend and other groups so as to manage, whether it be family support, peer-led support for young people, transition from youth services to adult services in the trans and gender diverse communities, and with it, the range of other packages of support that our trans and gender diverse communities need to properly and effectively engage in our world in a more meaningful way. But put all that together on top of the $55 million worth of various packages that we've seen over the last 5 years, this reflects a serious expansion of the programs that our equality portfolio seeks to build. But what it also points to is the important work that the Charter and the Pledge does. As we reflect today on IDAHOBIT Day, what are the next prospects for growth, for change, for advocacy, and for decency and opportunity for our LGBTIQ plus community? It is through those multiplicity of points of intersection that this Charter reflects. And I look forward to the opportunity of working across government, not just with the equality portfolio and those intersection points for the Rainbow Equality Project, but with each of you separately as well as to how LGBTIQ plus community points of engagement, leadership, and better outcomes can be variously delivered across all of how government operates. I don't have to tell the people on this hookup just what those forum measures are. I'm sure Adam and the work that Trobe are about to take us through will more than highlight that work. But what I do look forward to is the shared journey that we all need to participate in, to build from those shared values, to drive further change, and to make sure that equality is not just an aspiration, but a reality for our LGBTIQ plus communities. So can I thank everyone for the opportunity of saying a few brief words, and I look forward to the great work that the Charter and the Pledge has instigated, and I'm here to assist, and I'm sure the government is, so as to get as many names on that pledge as we possibly can, and with it, drive momentum for change. Thanks, Deb.
Thank you, Minister. And I just want to read a comment that's come up in the chat, and I think it says it all. That's an impressive package, Minister. But from Thornhammer, thanks, Minister Foley, and the 20 plus peak bodies, a forum and discussion like this could only be possible in Victoria, the equality state. Amazing announcements, and happy birthday, Minister. Very impressive package. Thank you. And thank you so much for announcing it here on this Zoom meeting this afternoon. I can see lots of smiles. Thank you so much. Right, now we get to move, as the Minister said, to hear from Adam. Known to many of you, but not to all of you, certainly wasn't known to the mainstream peak bodies who've become part of the signatories for this charter. It was his very research that drove many of us to come together and to think about how we could work more effectively to support our rainbow families. So now I'm going to introduce Adam. He's the Associate Professor of Public Health and the Deputy Director of the Australian Research Centre in Sex, Health and Society at La Trobe University, Dr. Adam Bourne. At La Trobe, Adam takes a leading role in the development of research that examines the health and well-being of the LGBTIQ plus populations. This includes writing themselves in for a national survey of health and well-being among LGBTQ plus young people in Australia, which was released earlier this year and was a key driver behind the development of the Charter. Adam will share with us the latest data regarding the LGBTIQ plus communities. After we hear from Adam, we'll have a panel session facilitated by Aram Hosey. The panel includes the Victorian Aboriginal Child and Young People's Alliance, and the chair of that, Raylene Harradine, the Victorian Government LGBTIQ plus Taskforce co-chair, Jayde de Bont Pipan, and the CEO of Mental Health Victoria, Angus Clelland. Lastly, then turn to the pledge and how your organisations can sign on. And as the Minister said, there's some work that we all need to do. We're in this together. And a whole of government approach to this, which is the Minister's been driving, but with us on the other side, hopefully we can do a whole lot more. So Adam, we're thrilled to have you with us today, and I'd like now to hand over to you to share your research with what is, I'm having a look, 160 people on this webinar this afternoon.
Fantastic. Thanks so much, Deb. It really is a pleasure to be here with you all today, and thanks for that lovely introduction. Thanks too to the Minister for making what sounds like some really exciting pledges or commitments rather in his opening address there. And may I also wish him a very happy birthday. So as Deb said, I'm Adam Bourne. I'm at Archers at the Trobe University, and I'm joining you also from the lands of the Wurundjeri people of the Kulin Nation. And I also extend my respect to elders past, present, and emerging. As Deb indicated, my role today is to talk you through some of the key findings emerging from a large survey of LGBTIQ communities that we have conducted over the last, we published over the last few months. So think of this as the kind of state of the LGBTIQ nation, a snapshot of their health and well-being. And I'm drawing on these two particular surveys. The first, Private Lives, a survey of LGBTIQ adults aged 18 and over, where we collected the data in about the middle of 2019. It was a big online survey with lots of social media promotion, both paid and through community networks. And writing themselves in, which was a survey of LGBTQA plus young people aged 14 to 21, which we conducted a bit later in 2019, but a very similar kind of method, and this large online survey promoted through a variety of different social media channels. In both instances, it was 2019, and hold that in your mind, this was pre-COVID. So a lot of the impacts that we have seen during COVID may have further exacerbated some of the issues I'm about to outline to you as well. The surveys are really large and really complex and really multifaceted. They cover off a whole range of different types of topics. And today, of course, I'm only really able to share with you a snapshot of a few of these, but just to give you an indication of what's included in the report. Because the samples are quite large, we're also able to break down these experiences according to the different intersections within our community. We're a proud community with a really rich and shared history, but we're also a very diverse community, and that diversity is reflected in our age, our gender identity, our sexualities, the states we live in, rural or metropolitan areas, our ethnicity, etc. And so we can reflect some of those findings, and I'll give a nod to some of those in the talk today. As I said, both samples are quite large, so we had just over 6,800 adults participate in the Private Lives survey, and with a large sample, just over 2,300 from here in Victoria. And in the youth survey, we had over 6,400 participate, with 1,859 here in Victoria. Because I'm talking about two different surveys, I've tried to make it easy for you by color coding them. So whenever I'm showing you something in red, it relates to the adult survey, Private Lives, and if I'm showing it in purple, it's the youth survey, it's writing themselves in. More than just being large samples, though, they're also really diverse, which is important if we're to understand those intersectional experiences. They're diverse across a range of measures, including the kinds of areas that people were living in. For the first time, we can understand more about the lives of those living outside of major metropolitan areas, and quite large samples living in rural towns or in regional locations. A big proportion of people who are trans and gender diverse, which means we can actually break down responses across 5 different gender identity categories. And then a large diversity in multicultural backgrounds and in disability as well, which isn't actually up on the screen, but also wide diversity. And we also were really fortunate to hear from a large number of Aboriginal and Torres Strait Islander LGBTIQ people in both surveys. Those data haven't been published yet, and they're subject to some further consultation and discussion with Aboriginal communities, and those will be co-published with them, hopefully a little later in the year. One thing I do want to acknowledge, though, is that although it was the large in reflecting a lot of different intersections within the community, you need to be mindful that these don't necessarily speak to the needs of people with an intersex variation. So while we tried really hard and we outlined in our report all the steps we took to engage people with an intersex variation, in both surveys, we struggled to recruit a sufficiently large sample to break down the findings for them. In Private Lives, we do have a chapter that reports on the 48 people who took part there. I mean, it gives us an indication of some of their need, but we just encourage people to be hesitant or to think carefully about how they might utilize data to apply to people with an intersex variation. So that's the background to the study, so you know what we're talking about. I want to then talk you through a range of different types of data that emerged and just spotlight a few key findings that we think are particularly insightful and really speak to the concern around the disparities we experience within LGBTQ populations. And I'll start with family and domestic violence. So we ask a question within Private Lives 3, the adult survey. Have you ever been in an intimate relationship where you felt you were abused in some way by your partner? We ask the same question of whether they've experienced that abuse from a family member. And what you see in both respects really is around 40% having had that experience at some point in their lives. That is a really, really high proportion. And you also see a large proportion of people having had that experience more than once as well. If you look to compare that to a general population, actually the best means of comparison is drawn from the Victorian Population Health Survey, where in 2020 they published a supplementary report breaking down findings to whether or not people were LGBTIQ or not. And there they found that 13.4% of LGBT adults had experienced domestic violence in the last 2 years, compared to 5.1% of heterosexual adults. Now, 5.1% is already too high. If it was 1%, it would be too high. But 13.4% is considerably higher, about 2.5 times higher than we observe within heterosexual communities, and perhaps speaks to a range of, there's a lot of complexity associated with how we understand and interpret that experience. The second set of data relates to housing and homelessness, and I've tried to put this all together into one chart. So you'll see here across the bottom is the gender identities of people we were able to engage with the surveys. Here in this first bar are people from writing themselves in, the young people aged 14 to 21. And what you see is that about 11.2%, so more than 1 in 10, had an experience of homelessness within the last 12 months. If you look at that for across, where they've ever had that experience in their lifetime, bearing in mind they can only be at most 21 years old to be involved in the survey, you see that nearly a quarter, 23.3%, had had an experience of homelessness. And this was considerably higher among those who were trans or trans men and trans women, and also those identifying as non-binary. And then within the adult survey, within Private Lives 3 here in the red bar, again, you see close to a quarter, 22%, having had this experience of homelessness at some point in their lives. And a really similar pattern emerges when you look at that across gender identity, with people who were trans men and trans women much more likely. And when we asked them what were some of the factors you think were associated with your experience of homelessness, very often it was people talking about rejection from family members, being made to feel unsafe at home, or being forced from their home in some instances because of a lack of support for their sexuality, or in particular a lack of support relating to their gender identity. The third set of findings, is just in relation to drug use. So this slide is from the adult survey from Private Lives 3, and it's a long list of drugs that we asked people, have you used any of these within the last 6 months? You see that in total, if you look at the bottom, about 44% had used one or more of these drugs, not including alcohol, at some point within the last 6 months. The most commonly utilized being cannabis, ecstasy, and cocaine. About a third, close to a third of people having used cannabis at some point in the last 6 months, about 4.4% methamphetamine. Now, if you compare that to samples of the general population, and a whole range of different surveys we do of the general population in relation to drug use, you see there's a considerably higher among LGBTIQ communities. So that experience of methamphetamine use about 4 times higher among gay and bisexual men, among LGBT people in the survey compared to the general population, and much higher rates also in relation to pretty much every single drug. I've just pulled out a few there to highlight. As important, or even more so perhaps, isn't just the rate of drug use, but it's how people are feeling and their subjective experience of that drug use. And what we saw was about 1 in 7 people, nearly 1 in 6, 14% reporting that they struggled to manage their drug use, or that it impacted their daily life. And that figure was closer to about 1 in 4 among trans and gender diverse participants. I think perhaps the findings which have attracted the most concern within the community, and I guess within aspects of the media and in government as well, are maybe those relating to suicidality. So we asked a range of questions around mental health and suicidality. We observed much higher rates of diagnosed depression than we would typically observe in the general population. There were high rates of psychological distress, and we were generally observed in the general population 4 or 5 times higher levels of psychological distress, and really significant disparities in terms of suicidality. So in Private Lives 3, we asked a range of questions about this. So firstly, about suicidal ideation. Have you had thoughts of taking your own life at some point in the last 12 months, a recent suicidal ideation, or at some point, some other point in your life? So in a recent suicidal ideation, you see nearly 40% having had that experience, shown there in the red bar. In the gray bar is the best available comparison we can make to the general population, just to give you an idea of what that figure looks like in a survey that was of the entirety of the Australian population. So a massive disparity in terms of having recently having had thoughts of taking your own life. If you look at that across the life course, have you ever had that experience? of thinking about taking your own life, then again, a really, really remarkable disparity, and nearly 3/4 saying that they'd thought of taking their own life at some point. Perhaps of most significant and most acute concern in the immediate term is the experience of recent suicide attempt. So about 1 in 20, 5% having of people in the LGBTQ adult survey private lives had attempted to take their own life in the last 12 months. And that compares to about to what we would typically expect within the general population to be closer to 0.4%. And if you look at that across the life course, about 1 in 3 people said that they'd attempted suicide at some point in time. A figure that's closer, that's around 3.6% within the general population. So if you think about that as a blunt comparison, you can see that the rate of suicide among LGBT people was 13 times higher among LGBTIQ adults than what we would typically expect to see in the general population for a recent suicide attempt, and about 8 times higher if you're looking across the life course. We asked the similar set of questions in Writing Themselves In, and observe a very, very similar pattern in terms of that disparity between the LGBTQA plus young people and the best available comparison to young people in the general population. Although we don't have the stats for all of these points in the general population. But certainly that recent suicidal ideation, nearly 3/4 having recently considered taking their own life. 11.8% having attempted suicide in the last 12 months, compared to what we would typically see as closer to 3.8% in the general population. And about 25% having attempted suicide at some point in time, bearing in mind they are only at most 21 years old. And that compares to about 5.3% we might observe within a similar kind of age cohort in the general population. Perhaps like me, you're watching this webinar and you're multitasking and you're looking at your emails or filling out some other paperwork in the background. So I'm going to say that figure again, just in case you missed it. I said 25% of LGBTQA plus young people had attempted suicide at some point in their lives. These are at most 21 years old. That rate is staggeringly high, one of the highest in the entire country, and certainly deserves an awful lot of attention and action. Once again, that experience is higher still if you're examining the experiences of trans and gender diverse people. So this is variation in suicide attempt in the red bar in the last 12 months and in the pink bar in the lifetime, but by gender. And again, you see this experience being considerably higher among trans and gender diverse people. So nearly in this time, nearly 1/4 of adults having attempted to take their own life in the last, of trans men, sorry, attempting to take their own life in the last 12 months, and more than half, 54%, had attempted suicide at some point in their life. A pattern which I'm afraid is similarly mirrored among LGBTQA plus young people, where staggeringly high proportions are having of trans men and women having thoughts of taking their own life, suicidal ideation, or having recently attempted to take their own life. Now, the numbers among cisgender men and cisgender women aren't great either. They're still pretty appalling, and I wouldn't wish to deflect attention away from them, but I am simply saying we need to be particularly mindful of how some groups are more impacted than others. As you think about those findings and those figures relating to mental health, hold in your mind the environment that many LGBTQ people still inhabit and the harassment and abuse or assault that they experience. In this adult survey in private lives, we saw more than 1/3 of people having experienced verbal abuse in the last 12 months, nearly 1/4 having experienced harassment, such as being spat at or offensive gestures in the last 12 months, and 14.6% experiencing threats of physical violence or attack in the last 12 months. Not historic, not experiences banished to the dim and distant past. In the youth survey, We saw more than 40% having experienced verbal abuse, nearly 1 in 10 experiencing physical harassment or abuse, and 22% experiencing sexual harassment or abuse in the last 12 months. So when we ask them where that was happening, you see that educational contexts are still a real site of concern, also within public spaces as well. We asked a range of questions about education-based experiences, in fact, and what we heard was a lot of young people still saying that they feel unsafe, that they feel uncomfortable, that they're used to hearing a lot of hostile commentary around LGBTQ people in their schools, and that actually quite a large proportion were missing school because they felt so unsafe or uncomfortable. Those things all matter. Those school-based experiences, those experiences of harassment and abuse in other contexts matter because they can shape a lot of the mental health outcomes that I was just talking to. In the youth survey, we've recently been doing some further analysis that hasn't yet been published, looking at what are some of the risk factors? What are some of the things that make that experience of recently attempting to take your own life more likely? Well, unsurprisingly, given what I showed you, it was much more likely among trans and gender diverse people, so about 2.3 times more likely among trans women, for example, that they recently attempted to take their own life. It was more common among those who were 14 to 17 years old. And it was 2.5 times more likely that if they had experienced harassment or assault based on their gender identity, which tells us so much about how those acts of aggression can shape mental health outcomes and experiences for this community. We can also look on the flip side at the protective factors, what makes it less likely. And this is where I think it's particularly heartening, where acts like this Ally Charter are so important. We see that people are 40% less likely to have attempted suicide if they felt supported about their sexuality by their friends and also by their family. They were 51% less likely if they felt a part of their school or education or context. And they were 25% less likely if they felt safe to identify as LGBTIQ at their school or educational setting. These things really, really matter. These acts of inclusion really, really matter in helping shape and improve health outcomes. My very last point is to just affirm the fact that many, many, many people within the LGBTQ community are having it tough, but there is also a lot of hope and inspiration we can derive from them. Have a read of chapter 14 of the Writing Themselves In report. It's wonderful quotes from LGBTQ young people about what makes them feel good about themselves. I'd really encourage everyone to have a read of these and think about how you can harness that creativity and inspiration when you're thinking about the services that you're designing and delivering. I want to close by just acknowledging our many funders and my co-authors at the Centre and in Rainbow Health Victoria for their significant contributions and all of the people who helped make the projects possible. I'm sorry, Deb, I ran 1 minute over, but I'll leave you there.
Thank you, Adam. It is in the chat, people are having similar reactions to the reactions you initially probably were on the receiving end when you presented at the Peaks, you know, earlier this year, and some requests there for can you share your presentation from Dern wants to share it with their YACVIC staff. So there'll be some requests that come out of this, and we can ask for your help on those as well. That would be fantastic. And also just from Dana, my colleague Dana, the horrifying data for young people. It's still, no matter how many times you see the data, it's really compelling. And one of the reasons why the Victorian Government is investing in this area, which is so exciting to hear those announcements today. So I'm now going to, thank you, Adam. Lovely to work with you and love your work. I'm now going to hand over to Aram Hosey, who's with us, who will introduce and facilitate our panel discussion today. So my understanding, Aram, is that you are a member of the task force, have enormous breadth of knowledge in this space, and we're now going to have a fantastic panel presentation, and then I'll hand over to Nev in the final few minutes to talk about how you can subscribe to the pledge. So thank you.
Thanks, Deb. Thanks, everyone. Before I begin, I want to pay my respects to the traditional owners of the land that I'm on today, the Wurundjeri people of the Kulin Nation. I want to pay respects to their elders, past and present, and thank them for their custodianship of this land over thousands and thousands of years. And of course, the focus of IDAHOBIT Day is about LGBTIQ plus equality, celebrating how far we've come and also really noting the discrimination that remains. But I think it's important to take a moment to also recognise the immense discrimination that Aboriginal people in this country have faced and continue to face, and the incredible strength and resilience that they have shown and continue to show in the face of that. So for most of the rest of this session, the next half an hour, it's my pleasure to be able to facilitate a conversation between three really excellent humans that I'd like to introduce now. First up, we have Raylene Harradine, who's the CEO of Bendigo and District Aboriginal Cooperative, and also the chair of the Victorian Aboriginal Children and Young People's Alliance, which represents 15 Aboriginal community-controlled organisations. Raylene is a proud Watchabalak and Latchi woman, and she's passionate about culturally inclusive practices, about equity for all, and achieving the best possible outcomes for Aboriginal children and young people. So welcome, Raylene. Our second panellist is Jayde de Bont Pipan, who is co-chair of the Victorian Government's LGBTIQ Taskforce, as well as being engagement lead at the Australian Institute of Sport. As an accomplished community development and inclusion specialist, Jayde has particular experience in developing and delivering large-scale inclusion plans and initiatives, which improve community cohesion and connection and belonging, things that we heard Adam talk about being so incredibly important. Last but not least, we have Angus Clelland, who is the CEO of Mental Health Victoria. Angus joined Mental Health Victoria, the peak body for mental health, in 2017, coming from a very diverse career which spans the private, public and not-for-profit sectors, having initially started his career in the defence and security sectors. His roles have included leading Lifeline Australia's National Crisis Service, as well as managing the Commonwealth 1800 Respect and Cannabis Information Helpline Services. So welcome to you too, Angus. And to everyone watching along, welcome to the conversation. We'd love you to be part of this conversation as well, actually, which you can do by dropping your comments and questions into the chat section. And I, with some assistance from others behind the scene, will attempt to pull that into the conversation. But to kick things off, I've got a question which I'd like to put to all panelists. And that is, as Deb highlighted in her opening remarks, the pledge is an Australian first, and it recognises that whilst we have come a long way and we're heading in the right direction when it comes to LGBTIQ equality, we still have a long way to go too. And that was very much something that was highlighted, of course, in Adam's presentation just then. So my opening question to the panel is, what do you think the most important next steps are for more people to embrace equality?
Are you okay for me to respond, Aaron?
Love it. Jump on in.
Okay. All right. Thank you. I really appreciate the opportunity to be able to sit on this panel today and be a part of the work that's happening on IDAHOBIT Day, and I really appreciate that. Before I begin, I would just like to, if that's okay, acknowledge the traditional owners of the land where I stand, the Judjarung people, which I am a part of as well, and pay my respects to them. And also other lands on where everyone else is standing today. So thank you. The question, well, I think if we were to accurately capture the experience of the young rainbow mob, it is about listening to their ideas and what they see as solutions actively. If you look at our mob in particular, we are really strong, and you pointed that out, Aaron. We are resilient and we are creative, and I'm very proud. I see our young people, particularly in this realm, as being the experts, particularly in understanding what the challenges are. But I also acknowledge the other thing too is, however, they too are vulnerable, and we as a society should be nurturing our young people to grow strong. And I think one of the key things, if we're looking at the next steps around everyone embracing the equality, I noted last night on a TV ad for Telstra, actually, I'm not promoting Telstra here, but just, it was around two male people sitting in a car, and they were wanting to ring his family to say that they got engaged, and they were really worried about it. But the response that they got from their family was really positive. So I think the campaigns that are happening at the moment, communication strategy around this, the LGBTIQ plus, it's really important how we promote the positive messages across the, not just our Aboriginal community, but also the, all communities. So I think, we believe as the Alliance that there is an urgent requirement for expanded appreciation and investment. And I think that's been given today by the Minister, and that is around assisting us to the unique and complex desires of our young people. So I think it is about identifying our young people, because there are a lot of our young people out there who are a little bit afraid to come, to express who they are. So it's kind of like having the space to be able to do that. I talked about projecting the voices too and the lived experiences. I think there needs to be also those opportunities as well. And that's around empowering our community-controlled initiatives that we have within the ACO space, but also some of the mainstream services as well. So it is around that. And I think while it is essential we hear the voices of our young rainbow mob, the burden of systemic change should not fall solely on them. I think it does require a whole government approach, Aboriginal community leadership and cross-sector collaboration with the voices of the young rainbow mob at the centre. So that's kind of like my sort of response just in regards to that.
Thanks, Raylene. And Jayde, if I could bring you into the conversation, Raylene there talked right at the end about the importance of the burden not falling solely on, in particular, Aboriginal young people. Also made some reference to things that we see in some of the mainstream, like a Telstra ad, and how important kind of that is. One of the things that the pledge looks at is around getting peak organisations to stand with LGBTIQ organisations. So it is this kind of concept of allyship and working and walking alongside people. So have you got any comments on kind of how allyship and why that's important and what good allyship can look like?
Yeah, thanks, Aram. And I too would like to acknowledge the lands that I'm speaking on today, and that's the lands of the Bunurong peoples of the Kulin Nations. Look, in terms of good allyship, and I've heard this from a lot older and wiser people than me, or being a good accomplice is around moving from solidarity or being aware and acknowledging that there's a problem into intent and meaningfully tackling issues and challenges with. And, it's been spoken a lot about today, so I don't want to dive kind of into all of what's already been talked about, but we can't do this alone. And I think Raylene hit the nail on the head when they said the burden of systemic change can't sit with the people who are experiencing the burden, so or solely experiencing the burden. So I really look at this pledge as an opportunity for peaks and other organisations to move from solidarity, moving from reading the research, having conversations, unpacking how certain data applies to certain cohorts, and actually shifting meaningfully to intent. And intent's going to look really different to everybody. Action is most likely going to look very different for everybody as well. But I think what the pledge sets out and what good allyship sets out is a common goal. And if we can all work together to achieve that common goal, we're going to have a really successful and a really healthy and well LGBTIQ plus communities. And the whole of government strategy that is in the works from the state government is a really fantastic example of something that's in the works. But as I think Deb mentioned earlier, like we've all got to be in this. We've all got to be pursuing this common goal. And if we can work together to work with, you know, some of the people who are most at risk, everyone in our society is going to benefit. Thanks, Aram.
Thank you. And I think that reflection on a common goal, you know, the statistics that Adam took us through, particularly around mental health, are horrifying. I think we can all agree on that. There's statistics that haven't shifted a whole lot in a number of years. And in many ways, I think that they are indicative of all of the problems. So if, you know, people's mental health is a reflection of the world that they live in and the experiences they have. And so if we saw a shift in those statistics, that would be an incredibly good indicator that everything is better for LGBTIQ people. So I guess within that frame, Angus, if I can unsurprisingly pull you into the conversation at this point, thinking about what does intent look like, what would meaningful action look like, what sorts of things do you think needs to happen, particularly within the mental health sector, to try and get on top of this crisis of mental health that we have?
Thanks, Aaron. Thanks for the opportunity to speak today, and thank you to Deb and Adam and Jayde and Raylene and everyone else on the line today. And I'd also like to acknowledge traditional owners of the lands in which we're meeting today and pay respects to elders past, present and emerging, to acknowledge the undoubted lived experience in the room today, the virtual room, and acknowledge the Minister, Palsec and Commissioner. And I'd really like to congratulate the organisers, not just today, but everyone behind the pledge. It is a terrific initiative. And what you should know, everyone listening today, is that you're not alone. There are many, many allies out there, including organisations like Mental Health Victoria, that are willing to support you and to roll up their sleeves collectively to address some of these issues with you. Now, from a mental health perspective, of course, we're coming from a position of a system in crisis, and there's no surprises there. And people like me are used to negative stories and statistics, you know, given my background with Mental Health Victoria and Lifeline and 1-800-RESPECT and so on. I sort of feel like I've seen it all. But when I hear the presentation from Adam, and this is the third time I've heard it, I'm still shocked personally. So that's an indication of just how significant the report is, and also the data that's sitting behind it. Now, we, I guess, are at the start of a massive reform of the mental health system here in Victoria, and also at a Commonwealth level, although that's going to take a little bit longer. We need to be able to factor into everything that we do. One, addressing the social determinants of mental illness and psychological distress, and that covers a whole host of different areas, but violence and discrimination and stigma are big ones that we need to address. We need to, in redesigning the entire service system, and we've seen this through the Royal Commission's report, create safe and inclusive services for people across the state, putting it as close as possible to people's homes within communities. And that's a key feature of that Royal Commission report. What we do need to see, though, is community-focused, designed and controlled organisations. And for some of you who are watching the federal budget last week, you might have noted a very large commitment of federal government funds for adult mental health centres and child and youth centres. In the text associated with that was a commitment for some of those centres to be community controlled, so Rainbow community controlled and Aboriginal and Torres Strait Islander controlled. And even though that was just a couple of lines in the budget, I think that it really shows a very significant shift in thinking at a Commonwealth level. And we're seeing that the same sort of thinking here in Victoria. We need to overhaul the service culture within the system. Part of it is about individual mental health workers, clinicians and others working in crisis. And of course, that doesn't create the best results for anyone. But we need to be able to reform the way that we deliver services across the state. And we can only do that through the involvement of the people that need those services. So rainbow communities and others need to be at the table. They need to be there assisting with the redesign and development and production of those services. Finally, we are, I guess, embarking on a 10-year sort of reform journey in the mental health sector here in Victoria. And I have no doubt that on Thursday this week, we'll see probably the biggest commitment of mental health funds ever made by any government in Australia. We need to look at our workforce and the people that are coming into the sector and that will, deliver the services over the next 5 to 10 years, and make sure that we train them and make sure that they factor in appreciation of all of these issues, concerns, and an appreciation for the diversity of our community. And that will take us, I think, a fair way forward. But guys, you're not alone. We're here and willing to help.
Thank you, Angus. And as I was listening to you talking, you were talking about reform and safety of services, and also that incredible importance of having the voices of people who are affected central to that, which was also something that Raylene talked about as well, lifting up the voices of Aboriginal young people in particular. I was wondering, Raylene in particular, but anyone, intersectionality is, of course, something that we talk about, but sometimes can be harder in practice. And as we're thinking about these issues, it's something that we want to keep kind of front of mind. So I don't know, Raylene or others, would you like to make any comments about the importance of how we take an intersectional approach to this work?
Yeah, I'm happy to jump in, Aaron. I think as the Alliance, we signed on for the pledge, and we have been a part of it since its inception. And I think we encourage, we always encourage the inclusion of the voices of our young Aboriginal and Torres Strait Islander people as well in the community. We'd also like the opportunity for the voices of our young people heard, and this may be done in various ways, and ensuring that involvement is from the outset. So whenever my experience, and I should say, if anything, it's about bringing everyone along from the outset, not as an afterthought, because I think that's a better buy-in, and also you get better outcomes. My professional working life, I've discovered. I think it's really critical that we we know at times this is complex for our young people, and intersectionality for the rainbow mob is challenging to navigate. And if anything, it's okay if you're the advocating on behalf of someone, but when it's affecting you, it's very hard to sort of, navigate any system whatsoever. So I think the intersection of poorer social and emotional wellbeing outcomes for Aboriginal and Torres Strait Islander people, and particularly our LGBTQI and community, means young people who identify as both are highly vulnerable. And I think that's already been spoken about earlier. The other thing is, I think just many of our young people reside in regional communities with little supports and connection. I think that is really essential to acknowledge that the issues facing our young rainbow mob are really sensitive, multifaceted and complex. So I think I'm sometimes I go off on tangents sometimes. There's so much to say, but we, navigating the intersection of culture and sexual identity in the community setting with many intersecting factors such as, and we haven't touched on this, religion, community views and perceptions, but also in cultural obligation is extremely difficult for our young people in this space. So we have, various layers that they have to sort of to deal with in particular. So I think that's why it's critical that we provide a bit of a forum or a system that can lend itself to being very, not just culturally friendly, but friendly just in the way of allowing our young people to be who they are, and whatever that looks like. We've also we have heard from the young rainbow mob that independent, and this is what they're saying, that independent safe spaces where young people can have their Aboriginality and sexual identity validated and visibly reflected in their environment could save lives. And we see that all the time. And I think if we're looking at that, you know, we think about creating a space where they can have access to mentors, and particularly to help navigate and explore their identity while maintaining their connection with their culture and community is essential. And that's one of the key things that we think about for our young people. I probably won't sort of, but I think, you know, when we think about the question and why it's important, why it's critical to take this approach, I think it's ensuring that, and I really welcome the opportunity with funding and resources to support the flexibility and services that we provide as community across our Victoria in particular, and particularly with our wraparound services within our organisations. They lend themselves to be able to create an environment where we can grow our young people, because ultimately at the end of the day, it's about affirming their identity, but then also reflecting the surroundings and the society. So I think that's probably about it for me for now at the moment. So
thanks, Raylene. And just mindful of time, I wanted to reflect, I guess, we had a couple of questions and comments come through talking about the experiences also of young people from multicultural backgrounds, and not only young people, but all LGBTIQ people and LGBTIQ people from refugee backgrounds in particular. And I think some of the comments that you were making about the importance of there being space for someone's multitude of identities and experiences to be held being so important. And some of those issues that you raised, I think, being applicable across a range of folks with different intersecting identities and experiences. As I said, mindful of time, maybe if we can finish here with this question, which is, as organisations or people who've been involved in this process of developing the pledge and signing up to the pledge, what would be your pitch to why people should join it and sign on, and where we go from here? A quick pitch.
Oh, look, I'll jump in, given that the other guys are quiet. I don't think we actually need a pitch, to be honest. We've got 100+ member organisations, including peak bodies and unions and many, many others, service providers, hospitals, etc. I think that it will sell itself. It won't require very much effort on our part. And when they see the organisations that are already involved, I don't think it'll be a difficult sell at all.
Thanks, Jayde.
Look, maybe what I would say is, just for the organisations or individuals out there who might be frightened by the pledge, and I'm sure there are a few of you that might, in terms of capacity, resourcing, money, time, things like that. What I would say is, look at the pledge as the beginning. This is a journey, it's an evolution. Sometimes we want a revolution, but it takes time. So I would really encourage you to sign up to the pledge and really look behind the curtain at your systems and your structures and your policies and your people as the first step. And as Angus has already highlighted, many people have in this discussion, we're all here to help. We're in this together. So it's a really exciting opportunity, I think, for us to come together and lead a really great initiative in Victoria. So that's, like Angus, I don't think there needs to be a pledge, but for the frightened ones out there, please jump on board and see this as the beginning and not the end.
I love that. I reckon that's a fantastic note to finish on, the idea of journey and journeying together, and that not everything happens in a revolution. It can be evolutionary and iterative, but it's getting started and working together. Thank you to all three of you for being part of that conversation, and to the folks who also sent through some questions. That's our bit finished for now. And so I think I'm handing back to Deb from here.
Thanks, Aaron.
Thanks, Aram. That was fantastic. You did incredibly well. It's always good to wrangle a really clever panel who have incredible and amazing things to say and nail it. So I could have sat and listened to the panel all day, frankly. Great insights. I'm now going to say a couple of words, and I'm going to hand over to Nevena. I want to say a couple of things. I want to say, just backing in Jayde's comments, solidarity is great, but intent's better. So I think those words are going to stay in my head. Jayde, thank you so much. I also want to acknowledge all of the sort of initial peak bodies that came around the table to listen to Adam's research, and for Thorn Harbour and Marina and Adam for getting in front of us and showing us the research, because as Angus said, he's seen it 3 times now, and every time you see the research, it's more upsetting and compels you to want to do more. So I just want to say thank you to particularly to Simon as well from Thorn Harbour, to Janet for getting us to here. And I mean really here, otherwise we wouldn't be here today. So I want to say thank you to both of you. I'm also going to thank Nev, who I'm going to hand over to now, who has worked with Jonathan from Thorn Harbour to do a lot of the creation, a lot of the behind the scenes, a lot of the hard work. So I'm going to hand over to you, to Nev, to help us understand the pledge, how to access the pledge, how to do the pledge. So are you there, Nev?
Yes, I am, Deb. Thank you.
Over to you.
Thank you. And thank you everyone who's joined us today. This is going to be very quick. We're really excited to be able to share our Embracing Equality website with you today. So it's my pleasure to be your flight attendant in Zoom land and take you to embracingequality.com.au. This is where will be our home for the campaign going forward. And when you log on, you get to read about some of that research and data that was so brilliantly captured by Adam today. You can also read through the original document that brought all the peaks together, the Embracing Equality Charter, and see, this is just so fantastic. What started as a conversation, then came to a couple of peaks, is now a very powerful group. And as Deb said, this is going to grow and grow. So if you're a peak and you'd like to sign on to the charter, please get in touch with us and we'd love to add you. But perhaps most importantly today on IDAHOBIT Day, we're encouraging service providers to sign our pledge. It's as simple as logging onto the website, putting in your details, your organisation name, and signing up for it. Once you've signed up there, you get our lovely thank you message. And importantly, you get a copy of the pledge to be able to insert your logo down the bottom there and very proudly hang in your organisation or office, wherever that may be. As Jayde said, the pledge is just the beginning. So don't think of this as something that, that you're going to be shackled to. This is something that we want to grow and evolve together. And as always, if you have any questions about this, our contact details are available on the website. Thanks very much, Deb, and I'll hand over back to you.
So thank you, Nevena. You did that very well. I probably wouldn't have done it technologically as well as you did. So thank you so much for that. Brilliant, brilliant work. There are lots of people to thank, lots of that in the chat. Adam's rightfully talked about Rainbow Health Victorian Archers and also the generous support of the Victorian Government for his research. There are lots of people to thank. I'm not going to name everybody, but thank you for being here today. We're still up to 100 people. We had up to about 160 people with us today for the launch of the pledge. As Nev said, please sign that pledge. Please become more active in this space. We all need to. People's lives depend on it. And without further ado, I'm going to close the meeting. Any questions, give us a call at the centre. But if you're a peak body and you haven't given us your logo for the charter, get onto the pledge if you can sometime today. Any questions, give us a call and we can help sort you out. Thank you to everybody on this call and have a good rest of the week and happy IDAHOBIT Day. Bye-bye.